Going over a quick training point here when it comes to chiropractic. Many times patients will ask, can I be over adjusted? And before we answer that, it's important to understand what an adjustment even is. An adjustment is something the chiropractor does to restore proper alignment to a misaligned spinal segment. So we have our spinal segments here that stack on top of each other. And when one of those segments becomes misaligned, the adjustment is restoring the alignment, creating better mobility through there. An adjustment can only be given to a misaligned segment. Therefore, you cannot be over adjusted because you're only getting adjusted when you have segments that are out of their normal alignment. You can, on the other hand, be over manipulated. Knuckles popped. Didn't need to pop. They weren't out of alignment. See, you can move joints around and make all kinds of noises. That doesn't mean that those things were misaligned. You can be over manipulated. Many times people will see an osteopath, physical therapy, and they'll do manipulation, which is fine. It's helped plenty of patients, but it is not an adjustment. I want to make that very clear. The chiropractic adjustment uses different pieces of the spine, more defined, more specific, more precise points in the spine, and the purpose of the adjustment, again, is restoring proper alignment so that what? So that the nerves in the body can work better, so that they can transmit information to the rest of the body better, thus maintaining overall body health. When you're being manipulated by an osteopath or a physical therapist, perfectly fine. As I said, helps a lot of people, but the end goal for manipulation has nothing to do with the nerves or better expression of life or better health. Also, many times when someone's being manipulated, they're using what's called long lever manipulation. So they're using their whole leg to just make a bunch of cracking sounds, release a bunch of pressure in the joints, again, which is therapeutic to some degree, but it is not a chiropractic adjustment. It's not as specific, and it doesn't have that end goal of affecting the nervous system, which is the controlling system in the body. So again, can I be over adjusted? Absolutely not. You have to have a misaligned segment in the spine to get an adjustment. So if you're adjusting segments in the spine that are not misaligned, it's not an adjustment. It's manipulation, like with the knuckles. Great question. Thank you to all the patients who pose these questions. Gives me a chance to respond and clarify some things about chiropractic. Looking forward to seeing you soon.